Hello, friends. Another edition of Facebook Live on bariatric surgery and metabolic surgery. We are going to talk about these major lifestyle diseases and how they can be surgically treated. It's very important that people should know what are the recent developments. We all knew conservatively how these diseases can be treated with lifestyle changes, like eating healthy, by exercising regularly. But even with that, very large number of patients are not able to maintain their weight or are not able to control their diabetes. And thus, it is important that they should have options. Those who can control with lifestyle changes should continue with that. But those who are not, for them, there are many options. And I'll be talking about probably the most effective option of them. That's a bariatric and metabolic surgery. So I'll be making a brief presentation now, and then I will take your questions. So let's have the slides, please. All right. So, surgical treatment options for lifestyle diseases. I am at Wockhardt Hospital in Mumbai Central and Hinduja Khar and Zen Hospital. And I have been doing these surgeries for over 22 years now. Why do we offer surgery for something like an obesity? Because after surgery, patients can lose 70 to 100% of their extra weight, and almost all of them maintain it long term. There are obviously few people who may not maintain it, but that's a very small number, maybe 10 to 15%. But 85 to 90% patients will maintain their weight even after 10 years. And that is the strength why people choose to have a surgery. There are different types of surgeries. I am not going to into technical details of these, but these are the commonly done surgeries in this country. The sleeve gastrectomy or a kind of gastric bypass. What's important in this is that surgery not only restricts the amount of food that the person can eat, but it also causes hormonal changes because the food comes in the stomach and it directly goes into intestine. And from there are certain hormones produced like GLP-1, which reduces hunger, which reduces craving, and which also helps in control of diabetes. So, this is more of a hormonal surgery than a restrictive surgery. How surgery works, as I mentioned, the change in hormones, less hunger, change in gut bacteria, food intake is limited, and in some surgeries, there is an increased energy expenditure. So that's the only way the energy expenditure can be increased, other than by eating regularly and by exercising. All these surgeries are laparoscopic or keyhole surgery. So there is no big cut on the tummy. These are small 5 centimeter cut each, and just surgery generally takes about 1 hour. Patient is able to walk by evening. They are able to drink water by evening, and usual hospital stay is only about 24 to 48 hours. So most of the patients are able to go home in about 2 days' time. Now, who are the people who are good candidates for surgery? If somebody is just 8 to 10 kg overweight and has uncontrolled diabetes, we can offer this surgery. If somebody is 15 kg overweight and has any other comorbidity like blood pressure, PCOD, sleep apnea, or has a poor quality of life, we can offer this surgery. And if somebody is 20 kg overweight, then even if he has no other disease except obesity, then also we can offer this surgery. So these surgeries can be offered to somebody who is just 8 kg overweight, because this is now Obesity is considered a disease, and we are primarily treating a disease. It's not a question of that the person should be 150 kg, then we can operate. We have operated on somebody who is 67 kg also. What happens after surgery? How the weight loss happens? This is our own publication. We did it in 2018, where we have seen that patient loses between 80 to 90% of their extra weight within 1 to 1.5 years, which is substantial, because if somebody is 40 kg overweight, that person is likely to lose between 30 to 36 kg weight within a year's time. I can show you some of the images. This gentleman from Africa, he came to us. He was 242 kgs, and within a year's time, he has come down to 98 kgs. That's his mother hugging him, and now look at him. He is so physically active. He couldn't walk a lot. He could get breathless, and he had so much swelling on his feet, and now he's fully active. This young boy, who was just 27-year-old, was 144 kgs, and within a year's time he came down to 69 kgs. So that is how the transformation happens as far as weight loss is concerned. Those people who also have diabetes, their diabetes gets corrected within a week's time. That means their insulin stops within a week's time, and most of the medicines stop in almost 80% patients within 1 to 3 months. And this is not a short lasting effect. In long run, even after 10 years, 35 to 36% patient will still not need medicine for diabetes. That means their sugars will remain under control without medicine. So it's probably the most effective therapy for diabetes today that we know as doctors. And it's not only question of diabetes, there are other benefits, like those who have sleep apnea, who snore at night, who are drowsy during the day. 95% of them will come out of it. Those who have acidity, almost 65% will come out of it. Joint pain improves substantially in 55% patients. Women who have PCOD or infertility, 70% of them will improve. And triglyceride reduced by 50 to 100 milligram in almost all patients. So that is how this actually works in patients. And because of this, because of multiple benefits of weight loss, diabetes reduction, triglyceride reduction, it has been established that at 10 to 11 years, patient is likely to have 50% less heart attack than if he had no surgery. So it reduces risk of heart attack in long run in all the patients. And because of this, there is an increased life expectancy. These people live longer. So if somebody who had diabetes and obesity, he is likely to live at around 9 years more, while if he had only obesity, he is likely to live at least 5 years longer than what he would without surgery. So surgery is not a question of how you look. Surgery is a question of treating a disease, improving quality of life, reducing heart attacks, and increasing lifespan. And then there are questions asked, especially when some young girl or a woman who comes to us with her family, that will it affect the pregnancy, possibility of pregnancy? Will it affect the baby's growth? So a very large number of women in the last 40-45 years have delivered their children, and all of them have been happy deliveries and healthy deliveries. So actually, after weight loss, the possibility of pregnancy increases because the fertility improves, hormone levels improve within 2 to 3 months, and in long run, whenever she gets pregnant, she can have a normal pregnancy without blood pressure raised, without diabetes, and maybe even a normal delivery. And most of them, all of them should be delivering a healthy baby. Just to show you this gentleman who came from Kenya, he was having diabetes, he would have obstructive sleep apnea, and he would also have joint pains. And now he looks so different that most of the people can't believe that he's the same person in both pictures. Then a question is always asked about surgical safety. Uh, but please realize that over a period of years, bariatric surgery has become very safe. Now it's considered safer than doing a laparoscopic gallbladder surgery. There are published studies on this. And it is also known that those who are doing larger volumes or who have more experience have better outcomes. And the most important thing is the last line, that not having bariatric surgery is more dangerous than having surgery, because I've just shown you the evidence that the possibility of heart attack is more in those who don't have surgery compared to those who have surgery. And so surgical safety should be taken in that perspective. And probably the best part that has happened is that from October 2020, the insurance in India is completely covering bariatric surgery. And there are criteria, but we can determine them for you. And the fact remains that 80% of the patients who we are operating are being done through cashless route today, and patient doesn't have to pay anything. So I think the acceptance of the surgery has completely transformed, because you are not paying from your pocket and insurance is covering. Incidentally, insurance covers only one type of treatment for obesity, that is bariatric surgery. They don't pay you to join a gym. They don't pay you to go to a dietitian for weight loss, or for medicine for weight loss, but they definitely pay you for bariatric surgery. So these are our contact details. We also treat patients endoscopically. So there are gastric balloons which we can put in. We can do endoscopic gastroplasty. That means we can suture the stomach from inside. And now as I mentioned, there are medicines which can help people lose weight. So the entire spectrum of weight loss management is available to you based on what is the necessity, what will work. So if you are just overweight and have no significant disease, then maybe medicine alone can be enough for you, and we can prescribe that. Those who are having slightly more weight and no major disease, then we can probably do endoscopic procedure. While those who have significant obesity as a disease or other diseases, then probably bariatric surgery is a better option. Let me just see if I can play this video. No. So now I can take your questions, and we can I can answer your questions. And if you have any more questions or comments, you can put it in the comment section, and I'll be happy to answer them. I've received a very large number of questions from you when you were registering. So I'll just go and answer those questions first. By the time, if you have any more questions, please go ahead and post them in the comment section. So I think Neetu has asked, how do we go about it and what would be the cost? So I think, Neetu, the way to go ahead is that you contact Dr. Madhu, or the number that has been provided to you. She can fix up an appointment with us. If you are from outside Mumbai, we can do an online consultation. If you are in Mumbai and ready to visit us, we can see you personally, and we discuss various aspects of your life. And then I can decide, or I can suggest to you which will be a better option, whether it's medicine or endoscopy or the type of surgery. Once that is decided, then we'll give you a list of tests to prepare you for that procedure, and then we decide when should we do it. On cost, there are many questions. I'll answer that at the end. What is the process of surgery, and on Mediclaim, can Mediclaim be used for this surgery? Yes, Bhavik, I have already answered that Mediclaim can be used. And the process of the surgery, as I mentioned, it's a keyhole surgery. So the you don't need to. So it's a very short surgery. It takes usually about 1 hour. A short bedridden situation. By in 5 to 6 hours, you are walking. When you go home, you can even drive car from hospital to home. That kind of recovery. You can climb steps. And if you are if you are having your own business, probably you can start working in 4 to 5 days time. So this is how the recovery happens. So many of you have asked about safety of surgery. Nitin, Annabelle, um, Durgesham, Dilip, the DJ, Sachin, all of us, is it safe? Are these procedures safe? How safe is it? So friends, and it all depends on what kind of disease we have. So if you are just 4 5 kgs overweight, I will obviously not tell you to undergo surgery. I'll give you medicines. If you have diabetes and you are just 8 kgs overweight, obviously I can do a surgery. But the surgery has become very safe. As I mentioned, the compared to a gallbladder surgery, it's much safer. And this is not an emergency surgery, so we prepare you well, and then we decide only after anesthetist and physician have given a fitness that we go ahead with surgery. But believe me, we do these surgeries every day, and these surgeries have become very safe. Obviously, nobody can give guarantees, but it is much safer than not having the surgery, because when you are not having a surgery, you are likely to have any of the complications of obesity or whatever disease you got. Then we have a series of questions on weight loss by Suma, Vaishali, Farida, Vidya, Ravi, Ramkumar, Shabnam, Hitesh, James, Swapnil, Uzma, Janvi, Divya, Sachin, Vaishali, Seema, Beena, Prakash, Riya, Shraddha, Prem, Seema, Afzal, and Sanjeev. So, the grossly the question is that how much weight can the person lose, for how much duration the weight loss will happen, and whether this weight loss will be maintained in long run. And another question is that fat is mostly in the belly area, so will it go? So these are, in general, these are the four type of questions which have been asked to me. So the first thing is how much weight loss. So typically patients lose between 70 or 80% of their weight to 100% of their weight, depending on their age. The younger people lose more weight. A senior citizen will lose 70%, while a 20-year-old boy or a girl will lose 100% of their extra weight. So that is the range, so that's phenomenal, because typically with diet and exercise you lose only 5 to 10 kgs. Now, for how long the weight loss continues? Generally, the weight loss continues up to 1.5 years. I have seen patients who have been very compliant and they lost up to 3 years. So, but on an average, between 1 to 1.5 years, the weight loss happens. Whether they can maintain their weight in long run, yes. A vast majority of them, between 85 to 90% patients, can maintain their weight in long run. It's so much easier. Only thing that is required is that you make certain food choices. Even if you eat out daily, if you make right food choices, you can maintain your weight. So I think maintaining weight is not a big challenge when surgery is concerned. Obviously, you will find 1 or 2% in the society who might have gained weight, but if you ask specific questions to them, all of them know why they have gained weight. It may be increased alcohol intake, it may be eating sweets every day, or eating fried items every day. But these are the details which will be discussed by the team with you when we will have our individual consultation with you. Then we have a question on side effects of surgery. So Divya, Riya, and Aniket have asked what are the side effects or after effects of surgery, and is there any side effect of this surgery, and how long the obesity will not come. So I think weight regain thing I have already discussed. As far as side effect is concerned, our patients are expected to have adequate protein intake after surgery. Now, since the food quantity is small, they need to have protein supplements and some vitamin supplements, maybe 1 or 2 tablets a day. If they do it, then the deficiency related side effects do not happen. So, major concern is whether the person will have deficiencies, whether the person will get adequate nutrition. But as long as you follow the instructions, because these are scientifically determined instructions, if you follow them, these don't happen. And these instructions are very simple. I've already told you, having adequate protein a day and maybe 1 or 2 tablets of vitamin, and then you are done because you will not have any deficiency related side effects. Then Seema, Leena, and Bharti have asked about diabetes and weight loss. So Seema has asked, tried various weight loss, but sugar problem is there. Bharti is also asking diabetes and weight loss, and Leena is saying, I'm having diabetes, what to do? So this is the most effective surgery for effective treatment for diabetes. If you want, you can go on YouTube and see one of my video presentation, which is basically for doctors, which says, is surgery the most effective therapy for diabetes? Please realize that in 1921, insulin got introduced. Before that, there was no medicine for diabetes. For thousands of years, people just lived or died or had diet and exercise as the treatment for diabetes. For last 100 years, from 1921 till 2021, the only medicines were available. Now from December 22, we are in a situation where we can say that we can offer surgery, and not only offer the surgery, surgery is the most effective therapy, because 80% patients within a year will go off medicine for diabetes. And even after 10 years, 35-36% patients will not need these medicines. They will not, their complications related to diabetes goes down and their lifespan increases. So I think as far as diabetes is concerned, Seema, Leena, and Bharti, it's a very effective therapy. And I have already shown you some of the slides. You can go on our YouTube. There are enough videos of patients and about diabetes surgery as such. Or you can go our website. There is a separate tab on diabetes surgery which gives scientific information with references, and you can check it out. There are a few more questions from Samina about weight regain. Samina, I think I have already mentioned weight regain doesn't happen in most of the patients and with a small effort. And luckily, most of the patients who are coming for bariatric surgery have gone through so much in their life. They are very happy to follow the instructions, and that's why most of them are able to manage their weight. Mamta has asked, is bariatric surgery possible without cutting the stomach? Yes, Mamta, this is laparoscopic surgery. So when you say cutting the stomach, if you're talking of the abdomen outside, these cuts are very small, 5 millimeter to 1 centimeter. Inside, the stomach size has to be reduced. There is an option where we can do endoscopically. We don't cut the stomach with sutures from inside. So there are options, and we can discuss that if you get in touch with our team. After, what is the next process, Benedicta? I think that has already been explained. You can, the number from where you got the appointment or registration, you can get in touch with her and they will explain to you how to take it forward. Jasleen has asked the eligibility for surgery and different types of bariatric procedures. Jasleen, eligibility I have already mentioned. Eligibility has changed over last 22 years that I am doing this surgery. Now I can offer this surgery to anybody about 35 BMI, to anybody about 30 BMI who has a disease, and anybody about 27.5 BMI if he or she has a diabetes. So I think I mentioned that in simple terms, in terms of kgs, but you can definitely contact us and we can assess your eligibility. Rakesh is asking about the post-op procedures. So Rakesh, post-op procedures are not a big issue because we Uh, they are very simplified. Most of our patients are from outside Mumbai, and we have a protocol where they can be followed with us. Uh, if you are from outside Mumbai, after 1 week of surgery, you don't need to even visit us even once. We can manage you online through this video consultations or chat sessions or WhatsApp groups. And these follow ups are also not very regular. You probably need to contact us at 6 months, then every year after that. So you can lead your normal life without bothering to come to us unless there is a problem. And only once a year you need to get the test done. So I think these are primarily the reasons why this surgery is gaining popularity, because this helps you lose almost 80 to 100% of extra weight, helps 80 to 100% of diabetes patients have a better control of their disease, and reduces heart attacks, as I mentioned. I have got few comments here, so I'll just go through that. So Muralidhar is saying my weight is 117 kgs and my height is 5'11 with high blood pressure. Is it safe to have surgery? Muralidhar, we also operate patients who are 67 kgs, and we also operate patients who are 280 kgs. So I think safety of surgery depends on your preparedness for surgery. How do we prepare you? On the experience of the surgeon and the facilities at the hospital. So I think these three things you must look carefully, because there like the hospital where I'm sitting and talking to you right now, Avocado Hospital is a center of excellence in bariatric surgery. There are very few centers of excellence. So that is one of the requirements. The second thing is how experienced this the surgeon is, for how many years he has been operating and how many patients he operates. So I think this surgery is pretty safe, and we can almost ensure that things should not go wrong. Then Murlidhar is also asking, only belly fat is more. See, this is a common perception of people, because you only see fat in the belly area. There are no bones in the belly area. So if I have little fat here, because of the bony support, it doesn't hang out. Similarly, if I have fat here or here, it doesn't hang out because the bones hold it back. But in the tummy area, there are no bones, and that's why the tummy hangs outside and it's visible. But when we are talking of, like in your case, I don't know your age, but if you are 5'11, your weight should be about 75 kgs or 77 kgs. So you are almost about uh, 40 kgs overweight. If you are under 40 years, you can lose all these 40 kgs. And that's the strength of this surgery. And that 40 kgs will not go only from belly. I mean, belly may have 15 or 20 kgs, but the another 15, 20 kg is distributed even from the face, arms, chest, buttocks, and thighs. Then Aparna Pritam is asking approximate surgery cost. So Aparna, the cost of the surgery depends on many factors. When you get it done under insurance, the insurance and the hospital have an agreement, because insurance company negotiate a cost with the hospital on the cost. So that is determined by what agreement a hospital and insurance company has, and I as a surgeon, you as a patient have no say in that. Now, if you are paying from your own pocket, then it will depend on which hospital we are operating. As I mentioned, I operate in 3 hospitals. Then in the hospital, what kind of room are you taking? Because the cost from a general ward to a suite class can be almost double. So it depends. So there are so many variables. Let's say 3 types of surgeries, 3 hospitals, and every hospital has at least 4 classes of accommodation. So all these three, if you take into account, it's very difficult to give you the cost, but they have become very reasonable over a period of years. When I started this surgery in Bombay Hospital, and now the cost is almost about, I'll not say 50%, about two-thirds of what it was earlier, and reducing. Endoscopic balloon is even cheaper. Endoscopic gastroplasty is there. There are medicines available. So there are various options, and we can specifically give you a cost package. There is no uncertain things. So once I help you identify the best procedure for you, our team will give you the definite package for that procedure. Now, Muralidhar is saying 49 years. I agree. I mean, so even if you lose 80 to 90% of your weight, that will help you. That means you can lose between to 30 to 35 kg weight, and which should be good for you. Seema is asking, if I am 53 years, then how much to lose? Seema, I don't know what is your current weight and what is your height. So you need to check that, and you need to share it with Dr. Madhu, and we can definitely tell you what would be but on an average, I'll tell you the best way to know what should be a good weight is you take your height in centimeters. So if you are 160 centimeters, your weight should be around 60 kgs. This is a very simple lay people's formula. So Seema has mentioned 122 kgs. So Seema, again, I don't know your height. So I know your age and height, weight. Now tell me your height also. And now Geeta is saying my weight is 99 kgs, but diabetes borderline. I can do it. I'm 60 years. Geeta, certainly we can do a surgery for you. Those who come early to us. So when you mention you have borderline diabetes, the literature shows you are likely to have 100% remission of diabetes. That means diabetes will never bother you in your lifetime. So those who come in first 5 years, they have 100% remission. Those who come in first 10 years, almost 80% remission, and likewise. So Geeta, for you, for diabetes and for your weight, both ways, this can be good. Now, Aparna is saying my weight is 110, height 5'3", age is 31 years. So Aparna, this is obviously a very good procedure for you because your ideal weight should not be more than 60 kgs. At 31 years of age, you are about 50 kg overweight, and at 31 years, you have many reasons to lose weight, more motivation than somebody who is 61-year-old. I'm not saying I'm more than 61. I'm also motivated, but you can lose all 50 kgs. Seema is now saying she is 5'4". So Seema, it's almost the same for you. Your weight should be 60 to 62 kgs ideal. And if you are young and if your weight is 122 kgs, you are almost about double your weight. And if you want, you can again lose most of it. Geeta is saying my BMI is 40. Yes, if your BMI is 40 and if you have health insurance will give you the entire, the hospital, the entire payment. You don't have to spend money for this. Meena, I think instead of individually talking, if you have any questions about surgery, about insurance, let's talk about that, because they are more important in long run rather than individual assessment. I have given a general guidelines. How do we know the height? How do we know the extra weight? And what kind of weight loss each one of you can lose. So if you have any questions like this, I'll answer. As one or two more of you have sent, I'll take them. So Meena says that her weight is 120 kgs, 5 feet 2 inches, 52 age. So Meena, you are almost about 45 and 20, about 65 kg overweight. At 52 years, you should be looking at losing around 50 kgs weight. If you do that, you will come down to around 65 to 70 kgs, which will be a good weight loss for you. Jaspal, okay, you are saying a 71-year-old, 5'10", 130 kgs, one stent. Can I go for surgery safely? Jaspal, those patients who have stents or who have undergone a gastric bypass are safer patients because their heart is in a better condition than what it was before the stent was placed in. And almost 15 to 20% of patients whom we operate have either stent or have undergone cardiac bypass surgery. we can definitely do that. So don't worry about neither about your age nor about stent. We are quite used to managing these patients in the past. uh, Seema, I think we have already discussed about surgery. So cost, cost can vary, let's say, from 1,75,000 rupees onwards, depending on what procedure is done and in what hospital it is done. So I cannot put a figure, because unless we have a one-to-one conversation with the patient, because the cost of the insurance pays to the hospital is very different than what you pay on the cash basis. And then again, there's so many variables, as I said. But I have given you a figure, approximate figure for the bottom line. It's about 1.75 lakhs. If you're doing a procedure, obviously, if you're taking medicine, that's hardly anything about compared to this. Rajesh is asking, where can I come and meet for further discussion? I am 43, my height is 5'10", and weight is 115. So Rajesh, I'm in 3 parts of Mumbai. I'm in Khar, in Mumbai Central, and Chembur. So you can revert back to Dr. Madhu, and she will give you appointment accordingly, whichever is convenient for you. Earlier, I used to go to so many cities all over the country and abroad to operate, but practically there is no time to travel. And I have found that it's better that you come to us so that we can see you daily during your surgical recovery. And definitely you are a good candidate. Your ideal weight should be again about 70-75 kgs, and if you're 115 kgs, you're about 40 kgs, and it will be good for you in long run. Aparna is asking, after surgery, are there any restrictions on food? Aparna, there are no restrictions as such, but what we say is you need to have your choices, or you need to have preferred food items. So the preferred food item is protein. How can I restrict carbohydrate in diet? Carbohydrates are so important for brain, for the entire function of the body. How can I completely stop fats? Fats are so important to keep us healthy. So I am not stopping anything after surgery, but I am saying you must get the building block, that is protein. What you normally get from your diet today, because you're not getting from the diet after surgery, you need to focus on that. We do not give excess protein. We give only what your body needs on a daily basis. And that is it. Now, this is common sense that when you want to lose weight, you cannot have fried stuff on daily basis. But once in a while, you cannot have oodles of fats or sweets every day, but you can have them once in a while. So most of the patients who come to us are already avoiding these items for years, not days. But they don't lose weight, they get frustrated, and they give up, and they say, okay, go to hell, I'll eat this, I don't care about my weight. But after surgery, you don't need to have a negative thinking. You just need to have minimal restriction, and you can do very well. I think that was the last comment. So thank you so much for all of you for joining this program. Please feel free. I can take the telephone number. It's, if you want, you can write it down. This is 982-01-70783. Or you can visit our website, obesity-care.com, and get more information. Have a good day. See you. Bye-bye. Take care.